Start by scanning the lower jaw, following the recommended 3-shape scan strategy, which is scan the occlusal surface from the molar to the canine. Wiggle the scanner when passing the centrals, and continue until you reach the last molar. Roll over the last molar and slowly turn lingual until you reach the other side. Either use the tip to keep the tongue away or enable AI to suppress unwanted soft tissue. Roll over the last molar and scan the buccal area for the whole jaw. When scanning jaws, you need to remember to make sure the scan has no or very little missing data and that it is trimmed well. After scanning, you should check for any missing data spots. You can choose a highlighting color in the settings to accent the missing data areas. Now rescan any additional areas if needed. Depending on the occlusal splint type, make sure to also capture at least 2 to 5 mm of soft tissue above or below the gingival margin, depending on the jaw. Inspect the scan when completed and move to the next step. Move to the upper jaw and scan it following the 3-shape scan strategy. Start scanning from the occlusal surface of the molar to the canine. Slowly wiggle the scanner while passing the centrals and continue scanning the occlusal surface on the other side. Roll over the last molar and scan the buccal side until you reach the last molar on the opposite side. Then move to the palatal side, going along the whole arch. Scan the palate, starting from the incisors, and slowly go from side to side across the palate in the distal direction. Inspect the scan when completed and move to the next step. Before you move on to the bite scan step, prepare your preferred bite registration method and follow the recommendations to set it correctly. Establish the desired interocclusal clearance and jaw position, and use the bite registration material or technique to stabilize the jaw. Make sure the scan exposes the canine region and the distal last tooth. When the bite index is in the patient's mouth, the jaws with the index needs to be stable while scanning. Use the preferred bite registration method and remember to trim away unnecessary material, especially from the buccal side, so that the material won't cover the teeth and block the scanner's visibility to the buccal aspect of the teeth. Scan the bite following the official 3-shape scan strategy. Insert the scanner carefully into the mouth and drag it to the side that you wish to scan. Try not to move the position of the inserted bite index. The scan should cover at least 3 to 4 teeth for a perfect alignment, even if the scan snaps together earlier. The bite will be aligned automatically. Please remember, though, in some situations you may have to align manually. Repeat this procedure for bite 2 on the other side of the jaw as well. Use the clearance tool. When it is on, the color palette informs of a clearance value. You can verify if the registered jaw relation is correct. Hold and drag the values on the palette to change its scale and have a more accurate overview of the situation. When scanning is completed, move to the Analyze page, where you can check the scans. And if everything is OK, post-process the scan data before continuing to send the case to the lab or for production in-house.